Research clinical trials have shown that if women who are invited to screening mammography starting at age 40 have a decrease in death rate due to breast cancer. Overall, if you screen women beginning at age 40, the death rate from breast cancer goes down by about 30%. There's been some controversy over whether or not to recommend breast self-examination, and usually it comes down to how comfortable the woman is with her body. If a breast self-examination is going to make the woman anxious, and if she's feeling lots of lumps and it causes her anxiety, then it generally isn't recommended. But if a woman can become familiar with her own anatomy, it's always better, because many women do find their own breast cancer. Genetics are an issue with breast cancer. There obviously are family histories that cause increased risk, but it's important to remember that the majority of women who get breast cancer have no family history of breast cancer. So it's important to get screened even if you have no family history. So one of the issues with screening mammography is false positives, which means that sometimes the test will be positive, we'll have to call you back for additional pictures, but there won't be anything wrong. That happens on average about 5 to 10% of the time. So out of 100 women mammograms who we read, 5 to 10 will have to come back, and the vast majority of those will just get an extra couple of mammogram views or maybe an ultrasound to resolve that the abnormality was nothing to be concerned about. Some women put off mammograms because they can be uncomfortable, or for some women painful. Unfortunately, compression is a necessary part of mammography, and although it can be uncomfortable, it's important to realize why it's being done. The better compressed the breast is, the better the picture, easier it is to detect the breast cancer, and in addition, the less radiation that the breast is exposed to. So why can't someone come up with a machine that doesn't hurt or pinch so much? Well, there has been a lot of research into breast cancer detection, and for any of you who've been good in donating money to any of the organizations that you see in October, much of that money goes to trying to find better ways to accomplish early detection. And there are some promising things on the horizon, but as it stands now, so far we haven't found anything that works as well as screening mammography for women in general to detect breast cancer early. We keep trying, but mammography is still very, very good, and we have to put up with the uncomfortable pinching for a little while longer.